to another episode of Dr. Kamini Rao's Masterclass.
That one-to-one relationship that you have with your patient is only possible in India. And over the years, I have so many anecdotes. Now I'm doing my second generation and some third generation deliveries. True is the saying, the hand that rocks the cradle rules the world, because unless you take care of the woman in the house, the whole generation is lost.
Kiran, can you tell me certain instances that really touched you, which really made you feel that you chose the right profession?
I have always been, and this is an advice I'd like to give everyone, I've always been true to my trade. What was my passion was looking after women, being there for them during their delivery, being very honest, doing only indicated work, never unindicated surgery. That was my motto. They said, Doctor, we have full faith in you. We will take the chance. They made me speak to their guru. And that guru told them, whatever Dr. Coelho says, the famous guru, So he says, whatever Dr. Coelho says, you do. So then they listened to me. I put the patient in steep head low, put in a Foley's catheter, and then did a rescue cerclage. This actor's wife was in hospital for 3 months head low. He had to do everything for her, everything on the bed, eating, sleeping, everything on the bed, not moving for 3 months till I brought her to 36 weeks. And then sent her home and had a normal delivery. And that actor told me, Dr. Coelho, I didn't know it was an arranged marriage. I didn't know my wife, but in this 3 months, we have become so close. We have forged a bond, which is now a lifelong bond. Then I had another baby. Again, I did cerclage, but then she could move around and she had another normal delivery. So this was, someone who is so famous and yet so humble, and listened to every word that I said, and God's grace which gave her that baby. That was one of real challenge in my life,
But Kiran, I'd like to ask you another question. Now, there are times, when you go ahead in your practice and you say that I'm very sure that this is what it is, and then you are suddenly, lo and behold, you are confronted with something totally different. I mean, how do you feel? I mean, how do you change your mindset and say, why did I go wrong in this? And how did you take this challenge?
You see, that happened earlier on in my career. Fortunately, now, Kamini, these sudden surprises are not there because of so
Because
much
of investigations.
investigations of 2D, 3D ultrasound. It's made life easy for us. And also, when we had very bad cases of placenta previa, anterior placenta previa, and all, now we have embolization. We have so many advances which help women. But in my earlier days, I remember there was a patient who I thought would have a normal delivery. And, I'm a great proponent of normal delivery. I sit with the patient, encourage them. It was a case of occipital posterior. And I gave her a very long trial. And then the fetal heart dropped. And by the time we took her for section, we lost the baby. And she kept telling me, Doctor, I was begging you for a cesarean section. Why did you take it upon you to do a normal delivery? Now, because of you, I don't have the baby. Till today, I remember those girl's words. I said, yes, it was an error of judgment. And we have to face, we are not gods. Even though we have much experience, but we learn from our every case. Every patient teaches you. And over the years, I have learned from my patients so much. I have learned from the mistakes of others. I have learned from my own mistakes. This fine judgment in normal delivery and a cesarean section, I'm sure, Kamini, you've also felt it, and all gynecologists who are listening to this would have felt the same thing. Today's world is, if you do also, you're damned. If you don't also, you're damned.
Absolutely.
So you have to develop that. And I have developed over the years sixth sense. I know who is going to deliver. I still remember earlier on in my career, there was this patient in Holy Family Hospital who was taken an executive suite. And she told me, I'm very disappointed in you, doctor. So I said, what happened? She said, I have taken the executive suite. I'm paying so much. So I expect you to sit with my daughter-in-law whole day. And you just come from morning and evening visits. So I said, I'll tell you one thing. You choose a guy obstetrician who has only one patient, and that he will sit with you all day. And the same one told me, don't be like those junior doctors. I was a junior doctor, and give long trials, and at the end you do a cesarean section. Be like the big doctors, immediately do the cesarean section. I was so alarmed at what she said, because she says, I have many daughters in law. I've seen all this. They give long trials and then finally they do a cesarean section. So I said, all right. I proved to her, I sat with that patient and I delivered her normally. So she said, हाँ आपका बात मान लिया doctor. So,
So
very
it's good.
often you have to have this back and forth with the patients and their relations, and you have to develop a very good sense of empathy, especially, with the patient, and, tell her to ignore all the other people around her. Just have faith in you.
Sometimes you feel, that you've had a personal kind of a win with these kind of women. It is usually the mother-in-law who brings the daughter-in-law and says that you people always do a cesarean section when normal delivery is possible. It's only when people like you will give them the normal delivery and tell them that this is how you should, then the mindset changes. It makes a lot of difference. Then the whole khandan starts coming to you.
Very true. I must tell you, Kamini, because of this perception that people are doing cesareans for money, and that really hurt me, because we know that we only do, and most obstetricians, I would say 99% obstetricians in India will do a cesarean section only because it's indicated. Now, because of that, you see, when from Holy Family, I started Lilavati Hospital. I was one of the first 5 doctors, and I had a say in the pricing. So I insisted that the surgeon's fee for a normal delivery and a C-section should be the same. So no patient will tell us that you are doing cesarean section for money. So till today, the normal delivery and the cesarean charges are the same. Then I started Khar Hinduja Hospital Khar. So that also was completely started by me, and I did the SOPs there as well. And in Hinduja Hospital Khar also, where now most of the actresses deliver, there also the fee is the same for a cesarean section and for a normal delivery. So I feel I've done my bit to assuage the patients that, the doctor is has your best interest at heart, and we want to achieve our goal of a healthy mother and a healthy baby, and we don't want to
Fantastic.
compromise. And in today's day, everyone is having their babies late. They have very few children. They have, so every baby is very precious. Gone are the days where, they had 7 children, 1 or 2 lost on the way. Is a, it tolerable. It's not tolerable. So we have to be careful, and that is the reason why maybe cesarean section rates have come up.
So, Kiran, now we've been looking at so many examples that you've given, and I'm so happy that you look at all women the same way and you look at priority given to the seriousness of the problem, and which is what we all should do, having taken the Hippocrates oath. And that's what you've been doing, and that's where people will look at and respect you, and that's how you've come up the long way. This is the ethical way that one would look at to come up the ladder. No shortcuts, and that's how we should do. But today in this world, I find that the youngsters want a shortcut to everything, the glamour. They see Kiran Coelho as the one that delivers the celebrities, and therefore they want to reach that goal. And so, what happens is a lot of unethical practices take place. The empathy is gone, and sympathy is gone, and there's only one thing, and that is a shortcut. What do you say to the current way of people practicing unnecessary cesareans and hysterectomies? What is your comment on this, Kiran?
Yes, it saddens me a lot, Kamini. And since I'm in practice now, as we know, for 40 years, I've seen a sea change in the way everyone practices. And I've seen a sea change in the way patients also look at us. I still remember earlier on in my practice, patients would, hang on our every word. They would trust us implicitly, would, follow everything, whatever we told them. They were so obedient, and they would trust us completely, and everything went well because of that mutual respect and admiration that we had for each other. That is lost completely, you see. And I think the foundation is a little bit more deep. I feel over the years, right from our time also, but even now, you see, there are very few postgraduate seats. very few medical college seats. And earlier in our days, it was the poorer and the middle class people who were going in for medicine, not really the rich. But over the years, what has happened, people are looking at medicine to be some a lucrative career. They are not looking at it from the point of view of service to humanity. And that is the crux of what has been lost over the years. I feel so, because I have so many students, and I feel so sorry because their goals have shifted. Instead of having a goal of being a good gynecologist, a good obstetrician, and actually looking holistically at the well being of their patient, they are looking at the patient as a potential, how much money they are going to make out of that patient, how to go up to the top in a short span of time. We have gone to the top after years of not sleeping at night, years of neglecting our children, years of sitting with patients and really, not looking at that aspect of it. But that is no longer there. You see, they have paid so much, or their in-laws have paid so much to get their postgraduate seat. They feel that they have, in the shortest possible time, they have to repay their loans. They have to repay their loans on their nursing homes, etc. So unethical practice has set in. Professor's post at Nair Hospital, and I was starting my practice at Holy Family and Holy Spirit. And my colleagues used to laugh at me. They said, Kiran, how are you going to work? You're not going to give cuts. You are not going to do abortions, because I don't do abortions. You are not going to this thing, and you are so senior. How are you going to manage? Believe me, Kamini, in 1 year's time, I couldn't manage the number of patients, because patients came. Each patient will bring 10 patients if you do the right thing by them. And if you do the wrong thing, if you do an unethical surgery, if you do, people will, then you will lose not only that patient. If you overcharge them, not only you will lose that patient, but you will lose that entire patient's community, because then they will think ill of you, because they have been hurt. Never hurt a person's purse is what I say. If a patient cannot afford, do it free, but let that person go home happy with the baby. That is that should be there. And how much does, I that's why I want to tell my young friends, how much does a man need? you know in our profession, we are so busy with work, and we are the ones who are dealing with life and death every day. Now in the pandemic, most people have come to realize the value of life, simple living, human relationships, everything which we as doctors had learned over the years, because dealing with life and death was so important that jewelry, clothes, money, parties, and all that were all secondary, at least in our generation. But now that is not so. Young people of today, the shortcuts are so many. Number one, give 30 to 40% cut to the GP who refers you. Number two, advertise. In the Hippocratic Oath, we are not supposed to advertise. But we see everyone, even the young ones, advertising blatantly in the papers that we are the best, we are doing this, we are doing that, etc., etc., and making false claims as well. Thirdly, is what I find extremely unethical is this ghost practice motive. You see, what is a ghost practice? I also came to know. Especially, it's come when endoscopy has come. We do laparoscopic work, and that has come after many years of the learning curve. So you have, long hours, and you practice, and then you become perfect, and you become a good endoscopic surgeon. As a surgeon, you should never settle for second best. You want to be a good laparoscopic surgeon, you will go to every single place, you will do cadaveric practice, you will call in mentors, you will do, and then you will be the best. You will study at night, you will learn the latest techniques, you will go forward, do robotic, do whatever you want, but always have the goal further and further, as you said, in mind. That is not there with the young generation. They will advertise, they will get posts in good hospitals where they will say, we are so and so attached to such a big corporate hospital, and they will call endoscopic surgeons to come and do their work for them, and they will tell the patients that we have done it, our patient. So they get medicine, and the endoscopic surgeon comes and does their work for them and goes and gets a pittance for what they have done, and the patient doesn't even know that a third surgeon has come in. That to me is very unethical practice, and that's another way of people just moving forward in life. There is no substance. And my take, and what I would like to share with everyone, is that if you do not have self respect for your own worth, and your own work and your own worth, then it's meaningful. You cannot sleep well at night. What are you doing? You're telling your patient, I've done this wonderful surgery and someone else has come and done it for you. Where is your self respect? Where is your self worth? This is not your what should be your goal. Money should never be one's goal. Money will come, it will come, and you don't want it. Half of it, most of us pay enormous taxes. So what's the point? We are working for the government, so you might as well work for less. You might as well do charitable practice, because how much does a person need? And I have inculcated that in my children. I never gave them. They traveled by public transport, Kamini. I never gave them a car and driver. They had to study on their own. They both went to the States. There were hardly any burden on me, and now are both are on their own, doing well in their own professions. They have never asked anything from us, and I think that itself gave them the fillip and the incentive to work. So you must,
Excellent.
you must lay your own goals, you must be true to your goals, and you must achieve it, and you must have self-respect and self-worth. Also, you must realize that when you cannot do something, then you can tell the patient that, see, this is there are going to be a lot of adhesions. I have to call in another surgeon and introduce the surgeon to the patient and say, see, my role in the surgery will be this, and his role in the surgery will be this, and that is why he's there, and that is being fair to the patient. So often now in
Absolutely.
this practice, when in the practice, I find, patients are coming and asking me, oh, doctor, are you the surgeon or will you be calling someone else? So, patients have also realized. Patients also say that, we have come to you directly. What will our family doctors say? And I can tell you over the years, Kamini, that many family doctors will send me their wives, their daughters, their relations, and their maids, but they will never send me a patient. Yeah,
Because they don't get a cut.
they don't get a cut. So, but that's all right.
Absolutely.
As I said,
That's okay.
your patient
But,
will lead to many patients. You have
no,
patients here.
but I would tell you one thing, Kiran. It really doesn't matter. But what really matters is, should there be a medical legal problem, or should there be a death on the table? Then who takes the blame?
When that happens, then it's the admitting surgeon and it's the operating surgeon on paper who takes the blame. So you are responsible for that. So that
So
everyone should realize that you are responsible. You're calling someone, but ultimately you are responsible. I have had a
correct.
patient who actually went from a periphery. The nursing home person called the traveling laparoscopic surgeon who had not even seen the case, and that nursing home person did not understand the gravity. Patient had an ovarian cancer, but they said ovarian cyst, and the laparoscopic surgeon did a nice ovarian cystectomy, and then upgraded the case to grade 4 in a case which would otherwise, if you had just done an open oophorectomy, she would have been all right. She would have been still in grade 1. So the upgradation of this case, say grade 4, and that patient actually wanted to sue, but then ultimately nothing happened. And another thing I would like to say, Kamini, is always another part of our Hippocratic oath, which I feel is very sad today, is always protect your colleagues. Never speak ill about your colleagues. And that's another thing that I find in the young generation, is in order to prove themselves, if the patient has gone somewhere else, they say, oh, but in their way of their manner and how they speak also, oh, this was very wrong. This other person should have done this. Now see, you've come to me, I'm going to save your life. That should never be there. And I find that, so then ultimately, even the patient gets confused, and the patient ultimately doesn't respect anybody, not the first doctor and not the second doctor. So we
Absolutely.
have to work towards gaining the respect of our regaining the respect of our patients. Initially, now,
Absolutely.
earlier, the patients would come with the baby, they were so overjoyed, they would give gifts, they would give flowers. Now nothing. They will come with sheaves of WhatsApp papers, whatever they have googled, and you spend half the time in your consulting room going through their Google sheets and then debunking all their bits. I'm sure you have the same experience. And every step
Correct.
of the everything they will this thing. Of course, it's not wrong. I'm glad they are well informed, but they cannot sift out the information. You see, so that's why they have lots of misconceptions.
Another thing, Kiran, that you've been a faculty for several training centers and in India and abroad. and you train and advise other gynecologists, etc. What has your challenges been, especially with hands-on training, particularly in endoscopy? It's been quite a challenge, isn't it? Especially
It is.
those who don't know how to even put a trocar in. What is your feeling?
Absolutely. And over the years now, for past 15 years, we have been doing, Ethicon has got wonderful animal training programs. So there should be a very structured program. I also have an endoscopic training center in my institution and head of institution at Lilavati. We have a very structured program. Just like all structured programs, initially it will all be theory. Everyone learns about the instruments, then they observe, then they assist, and then they do with mentoring. So that should be the way. So one is theory, all the, especially because we depend a lot on physical our equipments when we do endoscopic surgery. Skill is one thing, but we depend on our 3D, we depend on our our harmonic devices, our seal vessel sealing devices. Everything is a lot of technology which goes into it, all the cautery, etc. So you have a sound knowledge in all those equipment as well. Then after that, you go to all the instrumentation, a sound knowledge on all the instrumentation, very important. Then you go to models. We have pelvic trainers where we can train. That's wonderful. My grandson was telling me the other day that he's doing it on his box because they also do video games like that. So you train on endoscopic training with a pelvic trainer, then you go to pig animal labs. There are a lot of animal labs and cadaveric labs where you learn on. Then after that, you ask someone to mentor you. You do your first 100 cases with a mentor, then you do it yourself, yourself, and then after that you teach yourself over the way. And now we have so many methods, so many YouTube videos before doing a particular surgery. Like if you're going to do a laparoscopic ovarian cystectomy for a dermoid, then you read all about it, you have your instrumentation ready, you go to YouTube videos and see how different surgeons around the world are doing the same thing. You read the theory behind it, and then you're well equipped. So it's wonderful to do, but it should be structured. It's not that do one, teach one, and like teach one, do one, and then practice on your own. You can't do that. It has to be a structured program.
Absolutely. Now, there's another thing, marriage preparation classes. Now, that's unique, something that you've been doing and it's now gone into its eighth edition. So, Kiran, can you
Yeah.
please enlighten our viewers on this?
Right. So this marriage preparation actually, and my book is a bestseller because poor things, everyone have to buy it. Those who have to get married. So I'm the Catholic gynecologist for the Archdiocese of Bombay, and that is Bombay and Goa. So what happens is that the before the Catholic couples get married, they have to go through an engaged encounter and then marriage encounter. So these are preparations where the couple learn about finances, interpersonal relationship, then how to set up a home, then a psychologist also there, and then they have a priest to talk about the spiritual aspect, and then they have a gynecologist to talk about marriage and marriage, intercourse, childbearing, etc., in a holistic way, and not relying on very most people, what do they learn about sex? They learn through the internet, through Playboy, etc., etc. So they have unrealistic expectations of intercourse, sex, etc. They have unrealistic expectations. They don't understand a lot of that. So these are basically to talk about sexuality, morality, intercourse, how to time your intercourse for the to have a baby, how to time when you don't want to have a baby, the natural method of family planning, etc., etc. All these tips are given, and there is a question answer. That everyone wants to know so many things. They have so many vague ideas. So this is to debunk all those ideas. So that was how marriage preparation really helps a couple, not necessarily religious. I'm not talking about the religious part, but altogether interpersonal relationship, because most marriages end up because of actually unrealistic expectations in their love life. And you and I
Absolutely.
know that what problems people have. Yes.
So, this has been a very successful career for you. And I'm sure you wouldn't have taken up anything else. Given a second life and a second chance, Kiran, you would have done the same thing over and over again. And I'm sure I wouldn't be wrong if I said that. And I would like to say that over 3 decades of work in this field of women, and Save the Girl Child has been an initiative that you have made in Lilavati Hospital. And how has that experience been briefly? And how do you see the outcomes of this initiative in in future India?
Yeah, thank you so much, Kamini. We started this Save the Girl Child movement in quite some time ago, 8 years now. And every year we have a sort of fundraising also, where all we have, catwalk, ramp walk with all the celebrities and lots of talks, etc., etc. And that sort of brings a focus to save the girl child. That is from the publicity point of view. Then from the actual doing, we conduct in the hospital school health programs where free dentistry from all the municipal schools, the children come and have their dental checkup done, eye checkup done, ophthalmology, very important. You know how many children actually have childhood disorders, squint, strabismus, and which they don't realize till late, when it's too late. So we have ophthalmology. Then we go from school to school teaching young girls menstrual hygiene and nutrition for young girls in their adolescence. Then we talk about polycystic ovarian syndrome. We talk about all the problems a young adolescent faces. You know, like so many things. That so many girls are unaware of, even at that age, in that lower strata of society. By the time they are in high school, you know, they are already being molested and they are sexually active. Then how to take care about sexually transmitted diseases. All that thing we impart in the local language, and our resident doctors go, and we have adopted certain schools and areas where we help the girl child. And also a fund is created where if the pediatric child requires care and they cannot afford, then through the medical social worker everything is made free.
So, as an active participant in a social outreach activities that you've been doing, you've had several fundraising concerts, and I've really discovered that there's another side of Kiran, and I know that you're a very good singer. It would be great for our viewers to see this side of Kiran as well. And if you could sing one of your favorite songs for us, what would it be?
My gosh, now you're really embarrassing me. Out of the blue, how to sing something. Anyway, those were the days, my friend, we thought they'd never end. To sing and dance forever and a day. To live the lives we lead, to choose the friends we need. We thought those days would never, never end. That's a small excerpt.
Thank, thank you so much, Kiran. I think that was wonderful. I would like you to give some of your thoughts on what would a very strong message to the viewers today, that if you want to reach somewhere, what do you think that they should do?
All right, in a few words, Kamini, is that
Yes.
every person should not be mediocre. Mediocrity is the enemy. Always strive to be the best version of yourself. Always keep a goal in mind, because you know otherwise you want to do good, you want to, but you don't have a structure towards that goal. So first, recognize your goal, and that goal should always be something which makes you happy. You see, don't be a doctor just because your father's a doctor or someone else is a doctor, etc. If you really want, because it's there's no glamour in the medical profession, it's only hard work and heartbreak. Many is the time that you and I have realized that, you know, we have neglected our children in the field because of the career. In those olden days, the obstetricians used to be spinsters. Then of course, how many the time that I've never given my children holidays, because always there was some VIP person about to deliver. So therefore, keep your goals, structure your goals, work towards that single mindedly, and do not be distracted. And always keep in mind that to reach the top and to be the best that you are, you have to sacrifice a lot on the way. You have to change your mindset. watching movies, going out, etc., etc. Keep a little time for that. Don't let that be your be all. You see, the work towards that goal. Suppose you want to be a good endoscopic surgeon, then join endoscopic classes, practice on your patient, call mentors, take training abroad. I even at this age I went to Mayo Clinic and learned from robotic surgery. A wonderful course. So
That's great.
keep updating yourself always. Every night read, because where what the mind doesn't see, the mind doesn't know. So knowledge is so much of strength. There's a wealth of knowledge. Just imbibe it all, and that itself will be your strength. So knowledge is strength, hard work is strength, mediocrity is your enemy. Just say, okay, chalta hai, attitude is not there. I have to be the best. Otherwise, if you're not the best, you'll be winnowed out.
So, thank you very much, Kiran. That has been wonderful. Listening to you has been like music to me, and I'm sure my viewers have enjoyed it as much as I've enjoyed it as well. Thank you for coming on my show. So, that was Kiran Coelho. My dear viewers, that has been a wonderful episode. Until we have the next one, keep watching Dr. Kamini Rao's Masterclass.